about the placebo effect, which is a medical phenomenon about self-deception. I've been in training here for a few years now, since stumbling upon it, and even though I'm not really a medical professional per se, it's still something that is intriguing for me. So it's shrouded with a little bit of misunderstanding, some controversy, some skepticism, so it's kind of interesting. The example you might be familiar with is that of a sugar pill. So somebody with a headache is given an aspirin, or they think it's an aspirin. They take it.
This self-deception, this lie, occurs in the brain without any real medical benefit. So a little history. Placebo is Latin for I shall please, and it appears early in medical lexicon as any medicine adapted more to please than to benefit the patient. And this was in the late 1700s, early 1800s. And these are things like snake oils, bread pills. And another illustration of how far back placebos were being used is Thomas Jefferson. And he said one of the most successful physicians that he knew was a doctor that more often than not was prescribing placebos. Those bread pills, drops of water. And he was using those placebos more than the actual medical treatments. And a big term for the placebo effect was Henry Beecher. During World War II, he was a physician, and the clinic he was working at ran out of morphine, and the nurses he was working with just started injecting inert saline into the patients. And Beecher was still observing an improvement in the reduction of symptoms. So then he kind of ran with it, and he started placebo-controlled clinical trials. And that's basically today how we measure the effectiveness of medical treatment. We measure the difference between the placebo group and the group that got the medical intervention. And that's the primary use for the placebo. So it's not always a pill. It can be a shot, it can be a fake surgery, a cream, and then also it can be the ritual that surrounds a medical treatment. Things like the confidence of the doctor, the cleanliness of the room, the relationship between the patient and the doctor, things like dosage of the pill. These have all been shown to affect the effectiveness of placebo. And even stranger things like the color of the pill, the size of the pill, the type of the pill have been shown to alter the effectiveness. Something like a blue pill has been shown to be more sedative. So, for instance, if somebody's taking a sleeping pill that's blue versus somebody who's taking a sleeping pill that's red, the person who took the sleeping pill that's blue has been shown to sleep longer and sounder than the person who took the red pill. And that's just simply because of the color of the pill. Also, the capsules have been shown to be more effective. So this is a list of medical ailments that have been shown to have reactions to the placebo. Some things that jump off the page are some symptoms of autism, bipolar mania, warts, pain, nausea. One of them that's really interesting is depression. In some studies that have looked at the placebo effect in depression, it's seen that the placebo is often more effective than the antidepressants themselves. And in a meta-analysis of all different studies, scientists roughly attribute 75% of the benefit of antidepressants simply to the placebo effect. Another interesting case is that of Parkinson's disease, and that's by my main man, Fabrizio Benindetti. And one of the only treatments for Parkinson's disease is what's called a deep brain stimulator that basically hot wires the part of the brain that's troubled. And so what he would do is after the surgery, he would talk to the patient and he would say, all right, I'm going to turn on your stimulator. But of course, he didn't turn it on. He was lying to them. But because the patient thought the stimulator was turned on, the tremors would stop. And that's simply because of a lie, because of this lie the patient was fully buying into. And that's pretty neat, I think. So why does it work? It's important to note that the placebo effect is different from each ailment. And there's basically two different categories. There's the conscious reaction and the unconscious reaction. And the conscious reaction comes from suggestion, expectations, an overall reduction in anxiety of the situation. And this is coupled with a release of endorphins, so basically just making the person happier. And then there's the unconscious reaction, which is basically classical conditioning. You might know that from Pavlov's dogs. And that's coupled with the release of opioids, which actually, like opium, would treat the pain. So there's some skepticism of the placebo effect. Some people think it's just the reverse side of hypochondria, that if somebody's made up a disease in their mind, then yeah, sure, they could make that pain go away if they believe it's going to go away. Some people think it's just a coincidental remission of the symptoms that happens to happen at the same time as the placebo effect's being administered. And there's also some controversy. About half of doctors, in a 2008 study said that they regularly they prescribe the placebo. And people think this is the patient trusts the doctor. They're really just deceiving them. And even the American Medical Association has come out with some guidelines on how the placebo can be prescribed. So is there a use for the placebo? If it can be effective, can we use it in how we treat ailments? So for instance, take somebody who has arthritis and they take pain relievers every day. What if we replace every third day with the placebo and we can reduce some of the side effects? But there's some issues. It's pretty unpredictable, the placebo effect, and it varies from person to person. And even Dr. Benedetti, who did the Parkinson's research, who's a big advocate for the placebo effect, he doesn't really agree with the idea of bringing the placebo effect into the clinical setting. He sees it more as a research tool. So if you want to learn more, this is a pretty brief intro to placebos. And if you enjoy digesting your media auditorially, there's a couple podcasts that are really great. And then, of course, you can just Google it and read any of the countless publications that are out there on the topic if you want to read further. So that's it.